All right, this afternoon, let me just say good afternoon to everyone. Standing with me today, we have Congresswoman Sheila Jackson Lee from the 18th Congressional District, Vice Mayor Pro Tem Martha Castek Tatum, District K, Councilmember Edward Pollard out of District J, and Councilmember Carla Cisneros out of District H. Dr. Persse, Chief Pena, and Chief Roger West is also here as well. So let me just say that the Houston Health Department today is reporting 703 new cases of COVID-19, bringing Houston's total to 32,693. Unfortunately, today we are announcing 16 people today who have died as a result of COVID-19, which brings the number to 295. This is the first time since we've been dealing with this pandemic that we have announced double digits in terms of people who have died. The highest number that we've ever reported in any daily report was 9. Today we are announcing 16. I'm not going to read each one off individually, but they are listed on the monitors next to me, in front as well as behind me. I want to acknowledge each person's death because each one represents someone's family members or loved ones. And so even though they are listed like that, please bear in mind that families are now experiencing their pain, the pain of their loss. 7 of the 16 were Hispanic, including a 70-year-old man and a 50-year-old female who had no underlying health conditions. 5 of the 16 were Asians. There was also included in this list a black man in his 50s and 3 white individuals who passed away from COVID-19 recently. As I've said all along, the virus does not discriminate, and it is spreading uncontrollably in our community, and it is affecting people with or without any underlying health conditions. And it is important that we work together to slow the progression of this virus. July is a very important month, and so we need to do everything within our power to work together to slow the progression, and we do that by wearing these masks, and I want to continue to emphasize that, engaging in social distancing and exercising proper hygiene. This afternoon, I spoke with the superintendents of several of our school districts, and I want to commend all of them for carefully weighing the risks of opening schools during the pandemic, and they are putting the lives of their students, their teachers, staff, employees above all else. Houston Independent School Districts, the state's largest school district, announced its plan for returning to school. Reconnect safely, return strong is the motto for all students who will begin the academic year virtually on September the 8th. And online learning will last at least through Friday, October the 16th. The district will proceed cautiously in deciding when to return to the classroom, and I want to commend Superintendent Grenita Latham for the approach that she has taken. Also, as it relates to A-Leave, they will start on August the 6th, but they will start virtually and will remain virtually for the first 3 weeks. Aldine, for example, will start virtually on August 17th. Spring Independent School District will start virtually on August the 17th, and Spring Branch will start on August 17th, and they will give their parents choices of whether to be virtual or in person. And again, they are still kind of crystallizing their plans. Let me just say that it is very important to slow the progression of this virus now in the month of July, going into August, and that certainly is going to have a direct impact on what takes place in the months of August, September, and October. I am pleased to hear that Governor Abbott and the Texas Education Commissioner Mike Morat will be changing the guidelines to give school districts more time and flexibility, something which is sorely needed as cases surge in Houston and Harris County. Until we get the virus under control, we must continue to wear our masks, maintain social distance, and avoid large gatherings. We need 90% compliance over a sustained period of time to see a measurable difference in the spread of this virus. And by wearing your mask today, you are slowing the spread of COVID-19, and in 2 to 3 weeks, hopefully we'll start to see some results. At least we're going to throw everything that we have at this virus, everything that we can do locally. We intend to do everything we can do within our authority. We intend to do, and I certainly want to thank all of our partners, from Simone Biles to Slim Thug to Carlos Carrera to Trey the Truth, and so many others who have joined with us in encouraging people to be responsible participants. I also encourage people to get tested, and if you have symptoms or have been around groups of people, please do so. I was tested just this past weekend for another time, and I'm tested on a regular basis, 2 to 3 weeks, and I'm pleased to announce the results were negative, but that was only good for then. Still have to make sure that I continue to wear this mask and do engage in social distancing. The city has the 2 testing sites at Butler and Del Mar Stadium, and proud to announce FEMA will continue to be with us through the end of July. I want to thank Congresswoman Sheila Jackson Lee and everyone else for working to make that happen. Quite frankly, you don't want to push the envelope, but they'll be with us through July. At the way things are right now, we probably need them to stay, Congresswoman, through August. I'm just putting that out right now, just saying. And then we have partnered with 2 other locations for free COVID testing. The 2 sites that will be open even as of tomorrow will be at Fallbrook Church at 12,512 Walters Road in Northeast Houston. That's Fallbrook Church at 12,512 Walters Road. That's Pastor Mike Pender. And in Southwest Houston, in District J, Higher Dimension Church at 9800 Club Creek Drive. Those 2 additional sites will be open tomorrow. Both are free, but you need to schedule an appointment at 1-833-697-4839. That's 1-833-697-4839. So in addition to all of the other free testing sites, these are 2 additional testing sites that will be opening tomorrow: Fallbrook Church in Northeast Houston on Walters Road, and then at Higher Dimension Church, 9800 Club Creek Drive in Southwest Houston. Please take full advantage of these additional testing sites. And now let me pause and let me bring up Dr. Persse for more from the Houston Health Department. Dr. Persse.
Thank you, Mayor. At least I was a moment late because I was on the phone with the State Health Commissioner, Dr. Hellstedt, and I've spoke with him and Dr. Zerwas a couple times. I want to thank both of them for their support and their insights and their constant support. Today, the mayor pointed out that we've got a large number of deaths to report. And one of the things that we as Houstonians can do to slow down this virus, along with testing, is to work with the contact tracing that goes along with that. And we're going to have a graphic coming up here in just a moment to remind people that once you get tested, that you will then be contacted by for the folks who live within the city limits of Houston, you will be contacted by our contact tracing team. And this graphic represents the different ways that you will be contacted. You may receive a phone call from the number 713-853-8700. That's not a number that's going to be in your phone already, so you won't have already labeled it as the Houston Health Department. So if you want, you could right now take this number, put it in your phone, and identify it as the Houston Health Department if you have recently been tested and you're awaiting the results. That way, when you get a call from this number, you'll know who it is, and no, we're not trying to sell you a timeshare or anything along those lines. This is actually the Health Department trying to work with you to help stop the virus. You may get an email from the Houston Health Department, the graphic that it has there, at qualtricssurvey.com, or a text message. And if you get contacted by the text message or by email, there is a short survey that you will be able to do, and we find that the younger folks tend to like the electronic communication a lot better, and so that is very useful to us. But even if you get a phone call, we're going to go through that same survey and gather the same information, which will help us help you and your community, in particular your family and your coworkers. Remember, if you should be infected, the person you are most likely to infect, and vice versa, the person you are most likely to have infected by is a family member. So when we talk about contact tracing and stopping the flow of the virus, the number one first group of people that you're helping is your very own family. And the second group that you're helping the most are your coworkers, followed by friends and neighbors. So again, this is the way we will reach out and try to talk to you. Mayor also spoke about the importance of wearing masks. And so with our next graphic, I want to show a recent study that was published in the CDC, the Center for Disease Control and Prevention. They have a weekly publication, MMWR. It's the Morbidity and Mortality Weekly Report. For those in my line of work, this is a publication we look at very frequently. It has very timely, up-to-date information. And in the recent one, a study came out. Now, this is only one study, but it's an event. And what it was is there was a hair salon. And there were two hairstylists at this hair salon who were both infected and had symptoms, but did not yet know that they were infected with COVID. And so they continued to work. So, you know, I think everyone should know that if you think you're having symptoms, you shouldn't go to work, right? So, but they went to work. Now, where they worked at that hair salon, they were quite stringent on the fact that the employees and the patrons needed to wear masks. And that's very important. And, you know, we know in some of the businesses, places aren't being terribly strict about it. So in this case, the two stylists, over the several days between when they developed symptoms and when they found out that they were infected, worked with 139 clients. None of them became infected. Almost certainly because every single one of them wore a mask. While we're still waiting for the metrics to come out as exactly how effective a mask is, I am here to bet that when they finally get the measurement on it, it's going to be very, very effective. So clearly when you're getting your hair done and you're with somebody for them, you're not 6 feet apart. So we still advocate the 6 foot apart. I don't want anyone to think that this says you don't need to remain 6 feet apart. That's not what I'm saying. But what I am saying is that in this one instance, just one, it showed that wearing the mask is highly, highly effective. Today, the mayor reported double-digit deaths. Every one of those people who died from COVID-related illness, unfortunately and tragically, they were infected by somebody else, who was infected by somebody else, who was infected by somebody else. And somewhere along that chain of infections, if somebody worn a mask, this suggests that that would have stopped that chain of transmission. We would have had one less death. So, ladies and gentlemen, mask up. Thank you, Mayor.
Chief Pena.
Thank you, Mayor. Today, I want to share some troubling news. We have one of our firefighters, Captain, who was in ICU, got a report late last night that he has taken a turn in the direction that we did not want him to take. He's been intubated. Captain Leroy Lucio, he's a 30-year veteran of the Houston Fire Department, works out of Kingwood Station. He is in ICU. He has been intubated. I want to please ask the community to keep the Lucio family in their thoughts and their prayers. Thanks, Mayor, for your support on this. It hits home. Okay, this is one of our own. We want him to make a full recovery, but please keep him in your prayers. Today we have 175 firefighters that are in quarantine. This is almost 50% of what we had just about a month ago. So we're moving in the positive direction. We have 59 firefighters that have currently tested positive for coronavirus, 3 in the hospital and 1 in ICU. In regards to our occupancy task force, we had 69 complaints that we responded to over the last 24 hours. In the last 24 hours, we did not refer any business to TABC. Those that have been referred were this weekend. And again, we appreciate the business community for the help that they've been giving us in ensuring that we're providing a safe environment for our personnel. Wear your masks. I want to, everybody up here has stated the benefits of wearing the mask. I know our country has the smartest minds, medical and research minds, working on a vaccine. But this is the best advice we have for you at the moment. Wear your masks. Help us tamper the spread of this virus, because it's real. You know, and it doesn't feel it until it hits home. And we want to encourage people to do the right thing. I understand the impact that mental health and anxiety has on the mask wearing, but as the mayor mentioned earlier, 90% compliance, we can get ahead of this thing and hopefully get back to normal as quickly as we can. Maybe even send our kids back to school. Because I know parents, that's one of the things that at least my son has told me, can't wait till I get my kids back in school. But all of us doing the small things will help us get there a lot sooner. If I may, Mayor, just take a few moments just to relay just some safety information. It's the heat index is triple digits right now. Please, please, please keep hydrated. Limit your physical activity outdoors to early mornings or late afternoons, late evenings. Please be aware of any kids that you may have in the backseat in your cars. Look before you lock your vehicles. Last year, 52 children died in the United States as a result of being locked in a hot vehicle. Please, please, please be cautious. Look behind in your back seat. Ensure that your pets, certainly, but your children primarily are not left accidentally in the vehicle, or that your vehicles are left unlocked where kids can get in and play and lock themselves in there. It doesn't take but 10 minutes for tragedy to strike. So that's my report. Thank you.
And again, I want to encourage people wearing your masks, and if you need masks, please do not hesitate to reach out to any of the district council members, either district at-large council members, and they will have some available for you. There have been a few reports of people dressed as construction workers or City of Houston employees attempting to gain access into people's homes. It happened in Houston and surrounding areas. I want to stress that Houston Water employees do not enter homes to sample water for COVID-19. Let me emphasize that. City of Houston employees are not knocking on anybody's doors, asking to have entry into your home to sample the water for COVID-19. All employees are required to display their ID when out in the field. If you have questions about your water or water service, please call 311 or email 311@houstontx.gov. There are no City of Houston employees going into people's homes to test for COVID-19. So if someone comes to your home and said they're from the City of Houston to test the water for COVID-19, that is not true, and do not allow them to enter your home. Before I bring up Congresswoman Sheila Jackson Lee, if you all could put the chart right back of the people who have died that we are reporting today, the 16, because I want to emphasize the importance. Again, since we started talking about COVID in this city, from the first week, well, really from the latter part of February up to today, we have never reported a number in our daily press conferences, a number more than 9. We have never done that. In March, April, May, we may have said 0, 1, 2, sometimes got up to 4, 5, and then into June, we hit 9, 8, 9, but we never went past 9. Today, on this day, on July the 15th, we're reporting 16. For those people who think this virus is a joke, that is made up, not real, that is not having an impact, I want you to take a look at that chart, okay? And quite frankly, it covers the diversity within our city, okay? 16 people, families that have been permanently impacted. And a couple of the individuals that are on this list, these persons did not have any underlying health conditions, and they are not with us. This virus is real. We need to take it serious, and that's from the youngest of persons in our city to the oldest. And so again, I'm asking people to exercise your own personal responsibility Don't wait for the government to do more. Don't wait for the government to just say, shut you down. Don't wait for people to say you can't go to this particular event or this restaurant. The reality is that our destiny is in our hands. And if we want to reduce these numbers, the number of people that we're talking about who tested positive and the number of people that we have reported who have died in our city as a result of COVID-19, then we have to mask up. And quite frankly, we need about 90% compliance in our city in order to get the results that we are seeking. If you want to send your kids back to school in person, if you want to be on the football field, if you want to play soccer and all of these other things, if you want to be in the band and march in these bands, if you want to participate in these extracurricular activities, if you want to be in the stands, if you want the parades and all of these other things to take place, then what we do now in the month of July, heading into August, will be critically important. And so, again, I'm asking people in this city to take their destiny in their own hands. Let's mask up and let's do the right things. Now let me pause for comments from Congresswoman Sheila Jackson Lee.
Mayor, thank you so very much, and I hope you can see that I'm taking wearing a mask extremely seriously. I want to thank you for your steadfast leadership, and as well to the Vice Mayor and all of the council members who have been consistent in providing strong leadership to this city. And I am delighted to, as well, affirm the city's health department, Dr. Persse, Dr. Stephen Williams, and of course, our first responders. I'll start where Chief Pena was and offer my prayers and ask this city to continue its prayers for the captain of the fire department, who is, of course, in a manner and condition that warrants our deep prayers. And I also think it is important, as the mayor has emphasized, that each loved one who has passed is an important loved one, means something to us. There's not one that we don't mourn. And it is evident that this is a virus that is not a respecter of neighborhoods. And it does have a deep impact on Asians, Latinx, African Americans, and it also has an impact on all generational ages. So that is an important point that I wanted to make, and I also wanted to indicate that I was with Superintendent Latham as she made her announcement, which I know is similar to some of the other school districts. And it is important to make a point that we will not have any penalty of federal funds. When we return to Washington, we expect to pass the HEROES bill, providing about $100 billion to our schools for them to be able to be reimbursed for all of the sanitizing work that they will have to do, to ensure that they have the PPEs, because that will be necessary, and little ones will be wearing masks, school children, and we need to make sure that they are provided for as well. Mayor, you have reminded me of the enormous expense that you have encountered, and in that legislation, which there is no room for us not to pass it, will be upwards of $700 billion to provide for states, counties, and local government to ensure that we are able to reimburse for all of the added expense that you are now exhibiting. I think it is important to take note of two factors. I was delighted to host Dr. Anthony Fauci over the weekend, and a number of health professionals joined him in his admonition about where we are. There is no doubt that he is still a singular health professional of this nation because of the decades of experience that he has had. His recent commentary is that vaccines will not be present maybe until late 2020 or into 2021. Dr. Redfield, who is over the CDC, indicated that our most difficult times may be in the fall with the coming of the flu season and COVID-19. So even as our schools begin to open, it's important to note that I think all of them have said they will assess the circumstances of students and teachers and bus drivers and administrators, special needs children being in the school structure based upon direction of local leaders like the mayor and county judge. I thank them for that because our children are precious. And let me be very clear. There is no definitive science. I don't pretend to be an MD, but I've asked a number of different doctors and scientists that they can pinpoint the susceptibility of children for COVID-19 or their ability to transmit, to infect. And the reason I say that is because there are one or two or three, there are numbers of incidences that we've seen across the nation that involve children. So I think it is very important that we don't create hysteria, but that we realize that the science is still growing, if you will. It's still being developed as to what COVID-19 is and how it works. And we certainly know that it is going to be more impactful, even more impactful, as we move toward the fall with the flu and COVID-19. Mayor, I join you in mass up, but I also join you and thank you for viewing the numbers. Now more than 10,500 COVID-19 patients are in hospital beds in this area. In addition, as we well know, because of the crisis that we're in, we were allowed to have a Department of Defense team that I met yesterday that will be in our hospitals, in particular UMCC. That doesn't come lightly. That doesn't come when you're just at the beginning of, or you're at the downward trend of COVID-19. It comes during a medical crisis. So you have military personnel helping us because of the enormous responsibility that our medical professionals have, and I want to thank them as well. We are in a medical crisis. We're doing everything we can to give guidance to our community, and we thank you for massing up because it makes a difference. But I want to particularly thank the mayor for his thoughts and recommendation of a 2-week stay-at-home order. I still believe that that is the best approach to have, and I still maintain the letter that was sent by members of the United States Congress who are bringing a lot of federal funds here through the resources given of COVID-19 to the city and local governments, that the governor give that authority to local jurisdictions as needed. I think it is an important step, and if in the alternative that does not come, then I think it is worth considering for individuals, for companies and others, on a voluntary action to allow individuals to be able to work at home. To stop the community spread, it is extremely important that we do so by wearing masks, but not being out as much as possible if we can provide by it. So I thank you, Mayor, for that, and I wanted to close by saying education is crucial. Our children are precious. We will also be engaging with the White House on a national basis to ask the White House to, in fact, allow, again, local decisions to be made about education and to ensure that the federal funds that are so desperately needed in education, such as Title I funds for low-income communities, that we promise that those dollars are continued to come, which I was specifically asked about by the school districts. And that commitment, Mayor, will be as much as the federal funding. And I do want to add another test site for Saturday at the Reverend Dr. Max Miller, and that is at Hebron Baptist Church in the South Park, Southeast area. So thank you so very much, and we look forward to playing our part as the federal authorities. Thank you.